Across the country, black babies are more than twice as likely to die than white babies. That's according to the CDC. We got local numbers from Nurture KC, and they show every week there are a little more than 450 babies born in the metro area. Out of those, 2 or 3 of those babies will die before they turn 1. 87 will be born early, increasing their risk of health complications. Now, a new study has found the chance of survival nearly triples if a black baby is cared for by a black doctor. KCTV5's Casey Jones is looking into how the disparity may be playing out in our local maternity wards.
Here in Kansas City and in Missouri in general, we have a very high infant mortality rate, especially per capita. You feel like it's been hurting?
Dr. Tracy Johnson is a mother of 3 and board-certified OBGYN at Truman Medical Center. She says while infant mortality rates have declined in recent years, the racial disparities have not. The latest data for the Kansas City metro area shows for every 1,000 black babies born, close to 10 will die before their first birthday. Compare that to white babies. 4 will die out of every 1,000. And your baby's doctor could make a difference too. A new study published by the National Academy of Sciences pulled data from close to 2 million hospital births in Florida for over 2 decades. The study found that if black babies were cared for by black doctors, they were twice as likely to survive than if cared for by white doctors. Dr. Johnson explains shared race and culture can help doctors recognize subtle cues.
I know in the African American community, I pick up those things a little bit more often, and patients tell me that in their feedback that I do. That may be something that when you have a different ethnic background of the patient, that may be something that you're not able to see, and maybe it does translate over into the care for the infant.
So what can be done to ensure all babies get the same shot at survival? Tracy Russell, executive director of Nurture KC, says expanding Medicaid is a start because it allows better access to health care regardless of income. Missouri voted to expand its Medicaid program last month.
In states that have expanded Medicaid, they have a 50% greater reduction in infant mortality than states that have failed to act.
Russell also believes bias in medical professionals could play a role in disparities.
When you look at racism and how insidious it is, I think what we often lose track of is it's not just blatant displays, but it's that unconscious bias that's at play too.
How often are you having contractions?
As for Dr. Johnson, who is one of less than 10 black OBGYNs in our area, she hopes this new study reveals the need for more culture and diversity training in medicine.
We know for a fact that we're not doing very well when it comes to cultural humility in this country, and we use cultural humility as opposed to cultural competence because no one will ever be competent in someone else's ethnicity or cultural background. So that's something that we need to always do better at. If we're not having the conversation, we're kind of becoming behind.
Casey Jones, KCTV5 News.